The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Lateral Epicondylitis, aka tennis elbow, by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In this video, we will be discussing lateral epicondylitis, commonly known as tennis elbow. We will discuss what this is, how to diagnose it, and how to treat it. We will give you some simple home self-diagnostic tools as well as some simple home treatment remedies that may help you save that initial doctor's office visit. So first of all, what is tennis elbow or lateral epicondylitis? This is a pain due to a degenerative process at one particular tendon that inserts on the lateral aspect of the elbow or the outside of the elbow. Not to be confused with medial epicondylitis, which occurs at the medial or inside aspect of the elbow. Lateral epicondylitis involves the extensor carpi radialis brevis tendon. So only one tendon of the multiple tendons that insert on the outside of the elbow tends to go through this degenerative process. This tendon inserts at the point of the lateral elbow. So the most prominent point on the outside of the elbow is where this degenerative process occurs at the tendon insertion. Generally, this is associated with a repetitive motion or an overuse type syndrome. This is something that usually comes about very slowly. There's usually not a history of a trauma or an acute event where the patient all of a sudden had pain. This is something that usually rears its head relatively slowly. We'll see this in weightlifters and in laborers who have repetitive motion type jobs. Although we'll see this in gardeners and young women and really anywhere in between. Patients will complain of pain specifically on the outside of the elbow. Sometimes it's a little bit vague for the patients, but when we ask them to really focus in on where the pain is, it tends to be on the lateral aspect of the elbow right there at that tendon insertion. And so for a home diagnostic tool, you really need to focus in on where your elbow pain is. There's several different pain generators in the elbow, the most common of which actually is lateral epicondylitis or tennis elbow. So really focus in on where it's the most painful and palpate and rub that area and see if that is something that elicits pain. So if you can find the most prominent aspect of the outside of the elbow or the lateral side of the elbow, that's called the lateral epicondyle. Roll your finger just beyond that prominence and kind of just anterior or just towards the front and give a good deep palpation. That tends to elicit pain in patients with lateral epicondylitis. You can also make a fist and bring your wrist up and then try to resist that. So try to pull it down. That puts stretch on that ECRB tendon and that tends to elicit pain as well. You can palpate the other areas of the elbow and see if there's anything else that causes pain, because sometimes patients will have other issues going on, but most of the time lateral epicondylitis is an isolated issue on the outside of the elbow. Be mindful for any numbness or tingling. Typically this is not associated with lateral epicondylitis, and this is discussed in other videos. This can be something called cubital tunnel syndrome that actually occurs on the medial aspect of the elbow. So when patients come to see me in the office, other diagnostic tools are x-rays. We'll get an x-ray just to rule out any arthritis or any bone pathology. Occasionally we'll see a very small bone spur called a traction osteophyte on the lateral epicondyle, and that tells me that this is something that patients generally have been dealing with for a long time. So sometimes this can be a chronic issue for patients. Occasionally we'll need to get an MRI if there's any suspicion of something else going on. In about 5% of patients with lateral epicondylitis, they may have a concomitant nerve compression on the outside of the forearm called a posterior interosseous nerve compression. That's something that if there's any concerns that there's anything else going on other than lateral epicondylitis, we may get an MRI, and sometimes we can see some swelling around that nerve. Occasionally we'll get an EMG or a nerve study and see if we see any dysfunction of that nerve or the nerve on the medial side of the elbow. In terms of home treatment, generally, if you can avoid repetitive motions, or if you can avoid the aggravating factors that cause your elbow to be painful, do so for about 6 weeks, and oftentimes this will run its course. Tennis elbow tends to be a self-limited disease process, meaning if you can give this enough time, rest, anti-inflammatories, but more than anything, really just time, this is something that tends to run its course and get better on its own. Sometimes this can take a year or 18 months or more. Other home treatment remedies would be you can buy a tennis elbow strap, and you can get this over the counter at Walgreens or CVS or online. This is called a counterforce brace. This will indent that muscle, that ECRB muscle, and it takes away from the direct line of pull, and it helps rest that tendon insertion and helps the body heal. A very simple home treatment is just being cognizant of how you lift. So when you're lifting and doing repetitive motions, try to lift palm up. That transfers the stress to the medial aspect of the elbow, as opposed to palm down or palm to the side, which transfers the stress to the lateral side of the elbow.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.